Limiting the Risk of Pressure Ulcers by Samantha Haynes and Carter Frattarola. Introduction. Pressure wounds are skin injuries over bony prominences that damage underlying tissue. Immobility and strict bed rest can increase a patient's risk for pressure ulcer development. Pressure wounds have 4 different stages based on level of damage to the tissue. So our clinical nursing issue. Patients with impaired mobility or bedridden are at an increased risk for developing a pressure ulcer. The background and significance is if a patient is not turned, positioned correctly, given proper nutrients or skin care, pressure wounds can develop. Pressure wounds are rated in different stages depending on the damage to the tissue.
Current assessments involve doing a full head to toe assessment on the patient, using the Braden scale to score pressure related sores, and repositioning of the patient every 2 hours. Our question that we researched was, in patients with impaired mobility, does turning the patient every 2 hours compared to pressure reducing devices reduce the risk of pressure ulcers over the length of the hospital stay? In our search, we looked at databases including PubMed, CINAR, ERIC, NIHR, and Google Scholar. And we searched preventing pressure ulcers, pressure reducing mattresses, turning every 2 hours, and pressure ulcers. After our studies, we proposed changes such as to prevent pressure wound development, a nurse should reposition a patient every 2 hours, as well as using pressure reducing devices. Proper assessment and documentation should still be used.
So for our literature review, we used 2 articles. The first article compared the use of alternating pressure mattresses to a high specification foam mattress and the time it took for a category 2 or greater pressure ulcer to develop. The research used was an open perspective planned as an adaptive double triangular group, sequential parallel group randomized controlled trial with a prior sample size of 2,954 participants. The trial was set in 42 secondary inpatient facilities in the UK. The sample included adult inpatients with evidence of acute illness and at high risk for pressure ulcer development. The patients were randomly assigned either a alternating pressure mattress or a high specification foam mattress. Nurses checked the patient's skin and recorded changes over the 60 days. The treatment phase lasted a maximum of 60 days. The final 30 days were post-treatment follow-up. At the end of the trial, 132 patients developed at least one new pressure ulcer of category 2 or greater. 53 of those were using the alternating pressure mattress, and 79 were using the high specific foam mattress. The results showed no significant difference between the mattress and development of a pressure ulcer. Limitations in this research study is a lower than anticipated event rate. There was not enough of a difference in pressure ulcer development when comparing the trial mattresses to say one is better than the other.
Our next study researched if turning patients every 1 hour was better than turning patients 2 hours. This study was performed on stroke patients with impaired mobility over a 3-month time frame. The study sampled 49 patients, 26 which were in the intervention group and 23 in the control group. The control group was turned every 1 hour, starting on the right side, back, left side, and then back, while the other group was turned every 2 hours, starting on the right side, back, left side, back. Pressure ulcers were found in each groups equally. So the results stated that turning every 1 hour is not better than every 2 hours to prevent pressure ulcers. Some limitations that were presented in this study include the material of the mattress the patients were on, moisture, body temperature, room temperature, if the patient was wearing a diaper, and proper nutrition.
All right. In conclusion, there are many different devices and times to reposition that can be utilized to prevent pressure wounds. After researching many ways, patients still develop pressure wounds. Other factors that play a role, which are the material of the mattress, moisture of the body, nutrition, and temperature of the room, all play a role in a patient's risk for developing a pressure ulcer. Repositioning every 2 hours and the use of pressure reducing devices together are the most optimal way to prevent pressure ulcer development.